Hello everyone, welcome back to my channel. This topic is pneumonia, which is again from medical surgical nursing, disease of airway or respiratory tract. Let's get started. Pneumonia can be defined as unilateral inflammation and infection of lung parenchyma. We did not use any infection or inflammation word while we learned about COPD. Comparatively, pneumonia is the unilateral, that is one-sided infection and inflammation of lung parenchyma. Parenchyma cells that helps in formation and development of the lungs, characterized by chest pain and phlegm. It can be caused by either bacteria or virus and also might be contagious. Pneumonia pathogens is transmitted from one person to another through airborne route mostly. There is a picture with a comparison. This is a normal alveoli, while this is a alveoli which is sufferer of pneumonia. Because of chest infection and inflammation, there is deposits of the product of infection. There are types of pneumonia which are hospital-acquired pneumonia, community-acquired pneumonia, ventilator-associated pneumonia, and aspiration pneumonia. We have an explanation for each and every of them. Hospital-acquired pneumonia is a type of pneumonia which is caused due to hospital stay. The bacteria that are present in many parts of the hospital, either through next patient or through any device or through health personnel. Overall, hospital-acquired pneumonia occurs in a person after a long stay of hospital. Next is community-acquired pneumonia. This is transmitted from one person to another person in a community. So, this is not related to any medical institute or any hospital. This is just community-acquired pneumonia, which can be seen in any age group people. Next is ventilator-associated pneumonia. This is seen in the patients who are undergoing treatment by using a ventilator in an ICU. So it is called as ventilator-associated pneumonia. The infection and inflammation is related to ventilator. Aspiration pneumonia. This is when a minute food particle enters airway instead of entering the foodway or esophagus. Then aspiration pneumonia might occur. This might be due to problem in swallowing, problem in chewing, or intake of medicine, alcohol, or other form of drugs. Aspiration pneumonia. Etiology can be bacteria, virus, or fungi. Bacteria like Streptococcus pneumoniae, Mycoplasma pneumoniae, virus like Haemophilus influenza can cause pneumonia. Also, if it is caused by fungi, there are chances that Pneumococcus jirovecii can cause pneumonia. This factor can be age 65 plus and children less than 2 years because of their immunity, lack of immunity. In children less than 2 years, immunoglobulin are not enough developed, while in age 65 plus, as the patient's age advances, what happens in the body is degeneration. That degeneration occurs with the immunity cells as well. So, both the age are at risk. Other risk factor can be weak immune system due to pregnancy, due to HIV infection, or due to the anti-cancer drug, chemotherapy drugs. Also, it can be a result of a chronic medical condition, asthma, diabetes, COPD, sickle cell anemia, which exists in the body for longer than 6 months. Recent hospitalization can be a cause. Exposure to hospital device, exposure to ventilator, exposure to other health personnel. Yes, that can be another risk factor. Also, occupational exposure can be another risk factor. Stages of broncho and lobar pneumonia are as follows. This is also included in the types of pneumonia if you want to. Yes, broncho and lobar pneumonia. Stage 1. There is a stage of congestion. Stage 1. The enough muscles of lungs becomes less now because of congestion. Trying to increase the space because of accumulation of the product, and the muscles are not able to accommodate the increased volume anymore. So the fluid is filled with infectious microorganisms that try to over occupy the space of chest. That is stage 1. Stage 2 can be stage of red hepatization. In that stage, RBC enters the fluid and lungs become red and solid in appearance. Stage 3 can be stage of gray hepatization. There is change in color. That same RBC breaks down and broken RBC becomes gray in color. Stage of gray hepatization. Next stage is stage of resolution. Resolution is resolving. Immunity cells that are reach the place clear, and a productive cough helps to eject that deposited fluid inside out of the body. Clinical features are phlegm, rapidly rising fever because there is infection in the body. On auscultation, you can hear wheezing or crackle sound in the chest. Also, there can be fever, sweating, and chills. Shortness of breath. While coughing, breathing, or even talking, patient might face chest pain. There also might be fatigue. Loss of appetite can occur. Also, nausea and vomiting can occur, and headache can occur. Diagnostic test can be, first of all, history taking. We need to know about exposure to irritants and medical history while obtaining history. Next is physical examination, that is weight measurement and auscultation of chest. In physical examination, most important part is weight measurement. Because of continuous fever, there is fluid loss from the body, so we need to monitor the weight. Not only once weighing and recording, we need to monitor the weight on a daily basis. Also, auscultation of chest should be done on a daily basis to monitor the breath sounds. Blood culture and sputum culture both can be done to find the nature of pathogen, whether it is virus, bacteria, or fungi. Also, pulse oximetry can be done, whether to find out if there is lack of oxygen in the cells or not. CT scan can be done, MRI can be done. Medically, if you want to manage, there are antibiotics. Azithromycin, clarithromycin, and tetracycline. Each has its own doses, given twice a day, once a day, and once a day. Doses can be divided into two if the patient is unable to have one at once. Antiviral medicine can be given, ganciclovir 5 mg per kg and ribavirin 4 mg. Antifungal medicine also can be given if the causative agent is a fungi. For pain, acetaminophen and ibuprofen can be given, and through a nebulizer, bronchodilators can be given. Through a nebulizer, the liquid form of medicine is converted into vapor form and given to the patient. In general management, oxygen therapy can be provided 2 to 3 liters per minute. Respiratory therapy can be given, same respiratory therapy. Postural drainage can be done. Postural drainage is a form of physiotherapy which is done to drain out the secretion out of the body. In respiratory therapy, we have a professional respiratory practitioner in which we can practice the method how to breathe properly, breathe healthily. Though there is an infection, body is recovering from the infection, and how to train the intercostal muscles and the diaphragm to breathe again properly. This is about respiratory therapy. Also, chest percussion therapy can be given. In chest percussion therapy, chest percussion is performed so that the drainage or the secretion can come out of the body, airway can be clear, and patient can breathe again normally. So, postural drainage, chest percussion therapy, and deep breathing and coughing exercise can all be included inside respiratory therapy, which is performed by a professional respiratory therapist. If we need to manage it surgically, then a lung resection surgery can be done, resectioning the lungs so that it can function properly. Vaccination against pneumonia can be given, that is Prevnar 13, Pneumovax 23. This is given according to age. Complications of pneumonia can be emphysema, bacteremia, lung abscess, impaired breathing, ARDS, acute respiratory distress syndrome, and pleural effusion. Emphysema is accumulation of air inside the chest cavity. Bacteremia is mixing of bacteria in the blood. Lung abscess is deposition of pus in the chest muscles. Impaired breathing for a long period of time. Acute respiratory distress syndrome, group of symptoms is called a syndrome. Group of symptoms like dyspnea, difficulty difficulty in walking, difficulty in communicating, acute respiratory distress syndrome. Pleural effusion can also occur inside pleura. There is abnormal location of cells and air that is creating difficulty even more in breathing. Those can be the complications of pneumonia. Thank you so much. Next topic will be discussed in next video.